Marisol. I'm going to do my head-to-toe assessment along with my vital signs. Got my instruments over here. This is going to take place of a percussion hammer. This is going to be the tongue blade. This is going to be the tuning fork. I've got my pen light, and I've got this to test. And I've also got my stethoscope. So first I'm going to move into the physical examination, and first I've already washed my hands and I've already closed the curtain for privacy. I'm going to ask the patient a couple of questions before I start. Hello, I'm a student nurse at Brennan College. I'm going to be doing your head-to-toe assessment. The purpose for this is just to check your overall health and to see if we can find any abnormalities. Do I have your permission to continue?
Yes.
Do you need to use the restroom before I start?
No.
Okay, and this is going to consist of some position changes. Is that going to limit you in any way? Okay, so I've got her permission, I've washed my hands, I've closed the curtain for privacy, and now I'm going to move on to the mental assessment. So looking at her, she appears to be well-groomed, no bad hygiene, and her posture seems well adequate for her age. Now I'm going to look into her orientation. So can you tell me your name?
Raquel.
Do you know where you're at?
My house.
Do you know the day of the week?
Tuesday.
And who is the current president?
Donald Trump.
Okay, the person is oriented to person, place, time, and situation. So now that we did that, we're gonna look at her skin. I'm just inspecting her skin. At this point, I would probably want to put on some gloves just to maintain aseptic technique. So looking at her skin color is good. I don't see any redness, no marks, no bumps that I can see. She is Hispanic, so her color does match to her race. I'm going to check her temperature with the back of my hand. Her temperature is warm, not hot, but warm. Her skin is warm and dry. Now I'm going to check her hands, so if you can raise your hands up. Looking at her hands, I don't see any lesions of any kind. I'm going to check her capillary refill. Her capillary refill is less than 2 seconds, which means that she has adequate circulation. And now I'm going to assess for skin turgor. So you're going to feel a little pinch. Skin turgor is good. That means there's no signs of dehydration. You can also assess the skin turgor on your sternum and on your forehead. So now that we've done that, we've looked at her hands. Her temperature's good, skin's good. I'm gonna look at her scalp and just inspect it first, see if I can see any abnormalities from here. And then this is where I will actually palpate her scalp. So as I'm palpating her scalp, I don't feel any bumps, any lesions. Her head is normal cephalic. There's no growth deficits. Her scalp is good. So now I'm going to ask her to do a series of faces to assess for cranial nerve number 7, which is the facial nerve. So can you raise your eyebrows? Let's turn a little bit this way so you can see. Can you raise your eyebrows? Can you close your eyes real tight? Can you smile, frown, puff out your cheeks? Okay. She did all that without any problems. Cranial nerve number 7 is intact. So now I'm going to move on and assess cranial nerve number 5, which is the trigeminal nerve. And cranial nerve number 5 has both a sensory and a motor function. So first I'm going to assess the sensory function. To do this, I'm going to grab my fork. I'm going to ask you to close your eyes, and you're going to tell me if you feel a sharp or a dull sensation.
Dull. Sharp.
cranial nerve number 5, trigeminal, is intact. So now to assess the motor function, I'm gonna ask you to clench your teeth. Clench your teeth real tight, and I'm gonna assess the temporal and the inner masseter muscles, as well as assessing for TMJ. Can you open your mouth? Okay, cranial nerve number 5 is intact. So now I'm gonna move on to cranial nerve number 2, which is the vision, and I don't have a Snellen chart, so in this case, we already would say we did the Snellen chart. The patient has 20/20 vision, so cranial nerve number 2 is intact. So along with the eyes, I'm going to palpate her lacrimal apparatus. Okay, lacrimal apparatus is good. It's not swollen. And now I'm going to look at her conjunctiva. So I'm going to look at your conjunctiva, and can you look up for me? Okay, looking at her conjunctiva, her sclera is white. And I also forgot to mention, before I did all that, I would inspect the eyes. Her eyes aren't droopy, they're at a good eye level for her age. So now I'm going to move on to the direct and indirect light tests. So I'm going to grab my pen light, and first I will do the direct response test. So I'm just going to shine my pen light and look at your eyes. Okay, her eyes did constrict with a direct test, and now I'm going to move on and do her indirect test. And with this one, I'm going to shine the pen light to her eye and cover up her face midway and look at the opposite eye, and they should both constrict. Okay, and they both constricted, so the direct and indirect response to light are both good. Now I'm going to check for accommodation, and to do this, I'm going to have you just focus on the TV. When I ask you to look at my pen light, then you look at it, but focus on the TV first. Now look at my pen light. Okay, so her pupil is constricted, as we would want them to, because they're trying to accommodate to the pen light. So now I'm going to do the 6 cardinal positions of gaze and also test for convergence. This is going to test cranial nerves number 3, 4, and 6. So I have my pen light, and you're just going to follow my pen light. Don't move your face, just move your eyes. Okay, so I just tested for the 6 cardinal positions of gaze, and now to test for convergence, I'm going to have you look at my pen light and just keep looking at it. I'm going to move it closer to your face. Okay, so convergence is tested. Cranial nerves 3, 4, and 6 are all intact. So now that I've done the eyes, I'm going to look at her ears. So can I have you just look slightly this way? First, I'm going to inspect the ears. There's no lesions, no bumps that I can see, no signs of basal cell carcinoma. I'm going to look at her auricle, her tragus, and then I'm going to palpate the tragus, and it should recoil. Okay, the tragus recoiled. Now I'm going to look inside her ear. Okay, looking inside of her ear, there is no signs of cerumen, no redness that I can see, no inflammation. The ear looks good. So now I'm gonna assess or test cranial nerve number 8, which is the acoustic nerve, the hearing test, and there's 3 different tests that I can do for this. So first I'm gonna do the whisper test, so just look straight forward. And then I'm gonna get behind her about an arm's length. I'm gonna have you cover one ear, and I'm gonna whisper a word, and you tell me what the word is.
Bananas.
Okay, now cover your other ear.
Apples.
Okay, whisper test is good. And now this is where I would get my tuning fork if I had one. I'm just gonna pretend that this is the tuning fork. The first test is a Weber test. So I would strike it once, and then I would place it on top of her head. And can you tell me if you hear it in both ears? Mm-hmm. Okay, she hears it in both ears, the vibration. And this is good because this means that she doesn't have any signs of hearing loss or any of that. Both ears she can hear from. Now I'm going to do the rhyme test. And for this test, I would strike it once, and then I would place it behind her mastoid process. And then when she no longer could hear it, I would put it on out beside her ear to test for air conduction after I tested for bone conduction. So looking at this, I have a clock up there. I don't have my watch with me, so I'm gonna just look up at that clock. So I'm gonna strike it once, and you tell me when you cannot hear it anymore. Okay, so she could no longer hear it, so air conduction is twice as long as bone conduction. So both the Weber and the rhyme test are good. So now I'm going to look at her nose. I'm going to first inspect her nose. Looking at her nose, it's not deviated to one side. It all looks good. Now I'm going to palpate her sinuses. Do you feel any tenderness? Doing the frontal sinuses as well as the maxillary sinuses. Any tenderness? No. Okay, so no tenderness reported. Now I'm going to check for the patency of her nares. So I'm going to have you cover one side of your nose and just inhale. Now do the other side. Okay, both nares are patent. So now that I've done that, I'm going to assess or test for cranial nerve number 1, which is the olfactory nerve. So I'm going to have you close your eyes and just tell me what you smell. Smell it?
Pickles.
Okay. Cranial nerve 1 is intact. Now I'm going to look inside of her nose. When I look inside of her nose, I'm going to look at her septum, her inferior and middle turbinates. Her septum looks good. It's not deviated to one side. There is no inflammation of her inferior or middle turbinates. So now that I've done that, the nose is good. Now I'm going to inspect her mouth. First, before I look inside her mouth, I'm going to inspect her lips. Her lips look good. Pink, no signs of pylore, no cyanosis. Now I'm going to look inside of her mouth. Just stick your tongue back in. I'm going to look up at her hard palate. Her hard palate should be white. Soft palate should be pink. And looking at her tongue, there's no signs of inflammation. Her tongue is nice and pink. It's not swollen or anything. Looking at her buccal, there's no signs of lesions, no signs of kink or sores. Her gums look good. Now I'm gonna have you open your mouth again and stick out your tongue and say ah. And looking at that, her uvula should rise midline, which is cranial nerve number 10. Like I said, the rest of her mouth looks good. So now I'm gonna assess for tongue strength, and this will test cranial nerve number 12. So can you stick out your tongue for me? And I'm gonna have you, here, let's turn this way a little bit. And stick out your tongue for me, and then I'm gonna have you push this to one side. Good. Push to the other side. Good. So doing that, her tongue strength is good. Cranial nerve number 12 is intact. So now I'm gonna ask you to swallow. Okay, cranial nerve number 9 and 10 are intact when I asked her to swallow. And also when I did that, I noticed that her trachea is midline. I didn't feel any signs of swelling. Her lymph nodes weren't swollen. And now I'm gonna look at her neck. There's no lesions of any kind, no bruises that I can see. No open sores. And now I'm gonna palpate her lymph nodes. So I'm just gonna touch your neck. So first I'll do the occipital, post-auricular is behind the ear, pre-auricular is in front of the ear, tonsillar, submandibular, submental, deep cervical chain, posterior cervical, and now I'm going to assess for her subclavicular. So just raise your shoulders. Okay. I didn't feel no enlarged lymph nodes, no masses of any kind. So now I'm going to assess for jugular vein distension. So if I could just have you lie back. And for this test, you'd want them to be up kind of at a 45-degree angle. I'm going to inspect her neck. If I could just have you look to that side. Gonna look at her neck. There are no signs of jugular vein distension, which means there's no signs, which if there was jugular vein distension, that would be signs of congestive heart failure. There are no signs of jugular vein distension here. So now, have you sit back up? And do you feel any dizziness when you stood back up? It's important to always check and assess for orthostatic hypotension. So just with the different change positions, always ask them if they feel dizziness or lightheaded or feeling like they might faint or anything. And she said she didn't. So now I'm gonna palpate her thyroid and her carotid gland. For the thyroid, I'm gonna take the posterior approach. So I'm gonna get behind her. Okay. I'm gonna have you look down and then look to the right while you're looking down. Palpated her thyroid gland. Okay, and then I'm gonna come up to the front and I'm gonna palpate your carotid. So when I palpate your carotid, you always wanna do one at a time. If you do both, the patient can pass out. So I'm always gonna do one at a time. I'm gonna palpate your carotid. Good. Okay, carotid gland, there's no thrills, +2, equal. So now I'm gonna have you shrug your shoulders against my hands. Okay, I'm gonna have you turn against my hand. Good. Okay, we just tested for that against resistance and that assessed cranial nerve number 11. So now I'm going to palpate her radial pulses, and I want to do these at the same time to make sure they're equal. So I'm just going to have you. Okay, both her radial pulses are +2, they are equal. So now I'm going to assess for the finger grip strength. So can you squeeze my fingers as tight as you can? Good. So both upper extremities are bilateral in strength. So now that I've done that, I'm gonna go ahead and do the deep tendon reflexes for the upper extremities. I'll do the deep tendon reflex for the lower extremities when I move down to the legs. So this is gonna take place of my percussion hammer. So I'm just gonna do it once because this isn't an actual percussion hammer. So let me do it this way. So I would do the biceps, turn around, do the triceps, and then the brachialis radialis. Okay, so I've done the deep tendon reflex for that. And then I'm gonna assess the posterior thorax. So I'm gonna get behind and I'm gonna palpate the fremitus. So for this, I'm gonna place my hands on you. Every time I change my hands position, you're gonna just say 99.
99. 99. 99.
Okay, now that I've done that, check for the fremitus. I'm gonna also check for her chest expansion. So whenever I say go, you're just gonna take a deep breath, okay? Good. So both, checking for the chest expansion, both of my hands moved equal bilaterally. There wasn't one side that deviated more than the other. So now that I've done that, I'm gonna assess her breath sounds. When I assess her breath sounds, I'm gonna do it from side to side position. So, and I'm gonna do this with the diaphragm of my stethoscope. So when I do this, just take a deep breath every time I push my stethoscope on you. And I'm also making sure that I'm getting the lateral sides. Okay, all areas were clear. Now that I've done that, I'm gonna go ahead and percuss. And I'm gonna want to hear some timpani, which is a normal sound. So I'm gonna just percuss the back of your back. I'm gonna use 2 fingers. Okay, now moving on, I'm going to move on to the anterior thorax. So when I come up for the anterior thorax, obviously we'd assess for her breathing pattern. We'd want to make sure her breathing is normal. You'd always want to make sure at the beginning of the assessment too that they're not struggling to breathe. And looking at her, her breath sounds, or her breath is even, non-labored. She's not struggling to breathe. She's not cyanotic in any way. So now that I've done that, I'm gonna also assess for fremitus in the front area. So when I move my hands, just say 99 again.
99. 99.
And always get the sides.
99.
Okay. Now I'm also gonna assess her chest expansion as well. So take a deep breath. Chest expansion is good. It's equal on both sides. So now I'm gonna auscultate her breath sounds with the diaphragm of my stethoscope. Just take a deep breath every time I place my stethoscope. Breath sounds are good, they're clear, not diminished. So now that I've done that, I'm gonna assess her apical pulse. The apical pulse is at the 5th intercostal space at the mid-clavicular line. So I'm just gonna assess for your apical pulse. Should be right in there. When we assess for the apical pulse, we'd want to count for 1 full minute. So moving on, now I'm going to auscultate your heart sounds. I'm going to do the 5 traditional areas. And usually you can do this with both the bell and the diaphragm of your stethoscope. The diaphragm of the stethoscope is more used to hear higher pitch sounds, but for this case I'm going to use the bell of my stethoscope. So just turn to one side a little bit, or no, this side. So I'm going to use the bell of my stethoscope, and I'm going to do the aortic, which is at the 2nd intercostal space. Straight across from that is the pulmonic. Right under that is Erb's point. And then the tricuspid. And then the mitral. Okay? Doing that, I didn't hear any heart murmurs, no gallops of any kind. So moving on, now we're gonna move on to the abdomen. So if I could have you just slide back down. When we do the abdomen, just like any other thing, first we'd want to inspect before we actually do any physical touching. We'd want to inspect, then auscultate, then percuss, and then palpate. The reason we do that is because if she does have an injury of some sort, if we did palpation first before we actually inspected and auscultated, it could do more damage than what it already has done. So for that case, we're going to inspect, auscultate, percuss, and then palpate at the very end. So looking at her abdomen, I don't see any breaks of the skin. I don't see any scarring. It's important to assess and notice any scarring because that can be indicative of any previous surgeries that she might have had that we might want to know of. So there's no scarring, there's no lesions of any kind, no bumps, no bruises. Looking at her umbilicus, it is midline. There's no bumps, no redness of any kind that I can see. So now that I've done that, I'm going to auscultate. And when we auscultate, I'm going to use the bell of my stethoscope because this is a vascular space. So anytime we have a vascular space, we want to use the bell of the stethoscope. For the diaphragm, we can use that for breath sounds or anything of that. But for any vascular sounds, we're going to want to use the bell of the stethoscope. So, auscultating, I'm going to use the bell, and I'm going to start at the right lower quadrant and work my way kind of clockwise. So I'm at the right lower quadrant. Right upper quadrant. Left upper quadrant. And then left lower quadrant. Okay, vowel sounds are normal, active, and present in all 4 areas. So now that I've done that, I'm going to auscultate for the vascular sounds, which will include the spleen, the liver, the renal artery, and the iliac artery, and the aorta. And like I said, we would want to use the bell of the stethoscope for that. So I'm going to do the aorta, iliac, renal artery. I'm going to do the spleen, which is in the left upper quadrant. And I'm going to do the liver, which is in the right upper quadrant. Okay? All those sound good. Now moving on, we've inspected, we've auscultated, and now the next step is to percuss. So I'm just going to use my 2 fingers and I'm going to check for tone and just percuss. So starting the right lower quadrant. When we percuss, we should feel the dullness above the spleen and above the liver because that is a vascular space. So now that I've done my percussion, I'm going to move on and do my light palpation. When we do this, we always want to start with light palpation. So I'm going to do it to your right lower quadrant first. Do you feel any tenderness? No tenderness reported. When we do this, although the patient does say she doesn't have tenderness, we also want to look and see if there are any signs of guarding, if there's any facial grimacing of any sort, and that would be indicative of pain. So we've done the abdomen. Moving on, we're going to move on to the legs. So here, I'll just have you put your legs up here. Reach. So moving on, like the other areas of the body, we want to inspect first. Looking at her feet, I don't see any signs of edema. There's no varicosities that I can see. No deviation in the leg sizes. They're both equal. So now that I've inspected the legs, I don't see any lesions, no bruises, no open areas. I'm going to check for temperature like I would do for the upper extremity with the back of my hand. The skin is warm and dry, not hot, not cold. Now I'm going to assess for the dorsalis pedis, and that is on the very top of the foot. So I'm going to take my 2 fingers and just assess the dorsalis pedis. Okay, and I do feel it. Now I'm going to assess for the posterior tibial, which is in the inner ankle. So I'm gonna I've done that. Now that I've done assess for those 2, I'm gonna also check for capillary refill in her toes. So you always want to do it for 1 on each foot. Just to make sure one foot isn't doing something that the other is. Capillary refill is less than 2 seconds, which again means adequate circulation. Now that I've done that, I'm going to also assess for her muscle strength. So, can you push up against my hands with your feet? No, with your feet, just moving forward. Good. And now, good. Muscle strength is bilateral and equal in her lower extremities. Now, moving on from that, I'm going to assess for the heel to shin test, and this is going to test the cerebellum function. The cerebellum is in charge of the movement, so if she did have an abnormality of the cerebellum, she wouldn't be able to do this test. So for this test, I'm just going to have you take your heel and place it on the opposite leg and run it down your shin. Good. Now do your other leg. Good. So the heel to shin test is good. There's no signs of cerebellum deficit. Now that I've done that, I'm gonna do the deep tendon reflex. So I just have you sit back up and to the side right here. Do you feel any dizziness? No dizziness reported, so no signs of orthostatic hypotension. So I'm going to do my deep tendon reflex with my percussion hammer, and I'm going to do my patellar, okay, and my Achilles. Good. Now that I've done that, I'm going to assess for any sacral edema. So I'm going to have you kind of turn this way and looking at her with my pen light. I'm going to assess for any sacral edema. I don't see any sacral edema of any kind. There's no lesions, no redness, none of that. So moving on from the sacral edema. Now that I've done that, I'm going to assess her gait. So doing that, I'm going to have you just stand up. And I'm also going to check her balance. Just kind of, yeah. Do you feel dizzy or anything when you stood up? So now I'm going to have you perform what's called a Romberg test. I'm going to have you put your arms out to your side, close your eyes. While we're doing this test, we want to assess for any excessive swaying. There's no swaying of any kind. And you also want to make sure that you're close by to the patient, again, because if there is any excessive swaying, we want to make sure we're close by to prevent any falls and prevent any injury, okay? Now I'm going to assess for the tandem. And for this test, this is just assessing your gait. I'm going to have you walk from heel to toe, just short distance, that way. Now walk back. Okay, gait is good. She doesn't have any signs of an unsteady gait. So now that I've done all that, that concludes the head to toe assessment. Moving on, I'm also going to do her vital signs. So if you could just, well, no. I'm going to bring this chair over. And just have you sit there. And let me go grab my watch real quick. Okay, so for this, I am going to do her vital signs, and like I stated in the head to toe, we already got checked for privacy. My hands are already washed. I should already have gloves from her head to toe. It might be a good idea to go ahead and switch out those gloves when I'm done with my head to toe, just because I've been touching all over her body. So now I'm going to do a set of vital signs. This will include your pulse, your blood pressure, your apical pulse, any respirations, and then I'm also going to check for your peripheral pulses. Do I have your permission? Okay, we've got permission from the patient. Have you had any hot or cold substances to eat or drink? Okay, she hasn't ingested any hot or cold substances. So first I'm going to check her radial pulse and her respiration. So just put your hand up here. Just turn it over. So I'm going to assess her radial pulse and her respirations. Okay, that's done. For her radial pulse, I checked it for 30 seconds. I got 42, which we would multiply times 2, which would equal 84 as her radial pulse. And then when I was done with the 30 seconds, I checked her respirations and I got 10, which times 2 would equal 20 for her respirations and 84 for her radial pulse. And when you do this, I've learned that it's not a good idea to tell them when you're going to check for respirations, because then they might get nervous and just breathe abnormally than what they usually breathe. So just always check it when you're checking the radial pulse, and don't tell them that you're going to check their respirations. So moving on, now I'm going to do the manual blood pressure. Okay, if I could just have you put your arm up here. We kind of want her arm at heart level. And to make sure you have the right cuff size, you'd want to measure the circumference of your arm, and then make sure that it's less than or equal to 80 to make sure that you get the right cuff size. A lot of times, the number one reason we don't get the right blood pressure is because we don't have the right cuff size. So it's always important to get the right cuff size. So I'm going to put this on her arm, making sure that the arrows are pointing to her artery. And I'm going to palpate for her pulse. And then I'm going to put my stethoscope and go ahead and assess her blood pressure. Okay, this might feel a little tight. For her manual blood pressure, I got 110/68. So moving on from that, I'm going to assess now for her apical pulse. Like I mentioned in the head-to-toe assessment, are you okay?
Yes.
Her apical pulse would be at the 5th intercostal space, mid-clavicular line, and we'd assess this for 1 full minute. So if you could just sit straight up. For her apical pulse, I got 80. Now that I've done that, I'm gonna assess her peripheral pulses. The first one is the carotid, so I'm gonna do that. Carotid is right under here. No thrills, +2. Now I'm gonna do her femoral. If you could just come up and sit on the table. And lay on your back. And the femoral is gonna be mid-inguinal, so about right there. Okay, and then next I'm gonna do her popliteal, which the popliteal is right behind the knee. When I do that, I'll have you sit up. Do you feel any dizziness? And we do it right behind her knee. Okay, moving on, we're gonna do her posterior tibial. Like I mentioned earlier, it's in her inner ankle. So I'm gonna assess for that. And then lastly, I'm gonna do her, assess for her dorsalis pedis, which is always right on top of the foot. Okay, vital signs are all within normal limits. Do you have any concerns, any complaints? No concerns, no complaints voiced from the patient. There are no signs of abnormalities in both the vital signs or the head to toe assessment. Everything is within normal limits for her age. Her depth perception is within normal limits for her age. And that concludes the head to toe assessment and the vital signs.